I'm looking for.
Hi, good afternoon.
Good afternoon, y'all. We will wait a couple of minutes before we begin. Can you hear me? Thank you.
Yes, I'll step out for a few minutes because I need to pick up my son from the bus, but I'll be back.
Thank you. I'm still looking for my count on time. Mhm. What does it say?
Right now it's 3 o'clock.
Okay. Marco.
I think that yours took full screen, so it's hiding your clock. For now. It'll probably reappear.
Good afternoon, everyone. I'm Mary Margaret Oliver. I'm chair of the Workforce and Systems Development Subcommittee of the Behavioral Health Reform and Innovation Commission. I welcome you this afternoon to our meeting, which is being live streamed for the benefit of all those folks that are advocates for our causes for reforming mental health and have been participants with us in a very extensive effort. Thank you all for your participation. Thank you for your time this afternoon, particularly to our speakers. We are going to spend a little bit of time this afternoon and a little bit of a deep dive on the issues of data sharing among Georgia's agencies, which is a national issue. Every state's grappling with this, and we're going to have the benefit of a national survey of these issues of how we share data, particularly for our interests, healthcare data and mental health data, from Elizabeth Holcomb. And we also are going to hear from Dr. Kaslani, who's head of Georgia's Data Center, about the legislation that has been in the works for about a year to improve our opportunities, our policies, our systems for data sharing, again, which is based on a national discussion. Before we get to those details, important discussion, I'd like to do two things. I'd like for us to introduce ourselves. Since we're not in person, I think that's always good to do that again. And I will tell you that I think for our next meeting, I probably have 2 meetings before the end of the year. I hope we can be in person. That's my current plan. I'm Mary Margaret Oliver, chair of the subcommittee. I am from House District 82 in DeKalb County and have had a long political career, a lot of which relates to human services. Dr. Levy, would you like to introduce yourself, please? Unmute yourself.
Good afternoon. I'm Cindy Levi. I'm the CEO for Avita Community Partners and representing the community service boards.
Thank you. Dr. Koch.
Hi, I'm Dr. Sally Koch. I'm a professor of nursing at Georgia College and State University. And my focus is on increasing healthcare in the rural areas of the state.
Good. Good. Dr. Serbin, did she step out for the child trip and will be back with us in a little bit? Elizabeth, we'll let you introduce yourself and Dr. Castellani in a little bit. Before we get to our speakers and their valuable discussions this afternoon, I thought it might be helpful to give y'all a little bit of an update of a brief update of all the multiple areas of work that's ongoing with the commission. Chair of the commission, Kevin Tanner, and my co-pilot, as Speaker Murphy calls it, Todd Jones, and I have been in a lot of conversations since the session ended in a variety of different issues. And we are putting together in a variety, an outline of issues that we intend to address in another bill that'll be coming forward in draft form before the end of the year. I'll just touch on these particularly as they relate to our subcommittee, because they're important discussions and you will be advised of them in more detail as we go forward. On the loan forgiveness program, we're having active conversations with Grant Thomas, with the Georgia Health Strategy Coordination, and with Lynn Riley with Student Finance on implementation issues. We are spending a fair amount of time on that. It's an important set of discussions, but we're making progress. On the behavioral health survey that's required by 1013 in section 2, we have met with the new director of the Workforce Board, Mr. Pastine, and he has given us a good update on the work that he's done to try to complete the statutory requirement of creating a behavioral health database, all the workforce that we have available to us, along with a survey. I don't think as people come from their licenses or renewals of licensures, that we consistently, uniformly ask them specific questions about their practice. But we are doing that as mandated, as you know, in 1013. And he has met with various boards already, and he is coordinating with the vendor that does a lot of his workforce database. And he feels like he's on schedule to make this survey available to folks coming by in compliance with section 2.2 of the bill. We also are fielding questions and inquiries about where does the money, how can we get the money for the co-responder programs. You know, we funded a good number of those. I mean, 5 additional programs in addition to the 10 that were already formed. And we are very happy with the interest on that. The grant applications for the AOT program will go out October 1st, and we're looking for grant applications to be awarded by January 1st. All of those are in the bill. We are having active discussions on the statutory requirement that we form a new match committee. And we're having also a good number of discussions about the homeless population and mentally ill. The issue of credentialing of professionals is also a part of our discussion and may come specifically to our subcommittee in the future. We did pass successfully a number of bills to help with licensure being transferred from one state to another, but the questions or the consumer complaints that we seem to be getting, all of us, have to do with originating a licensure process under the Secretary of State. So we'll be having some additional discussions on that. Anybody who is interested in any part of the bill, any other subcommittee or further with our subcommittee, very much invite you to participate. I'm happy to give you updates. You know, in the last quarter of 2021, we circulated a draft bill to lots of different agencies. That was a good set of early discussions on 1013. And I'm really hopeful that we will have an opportunity, that's our plan, that we'll have an opportunity to start circulating a bill that improves the implementation of 1013, expands our authority, it clarifies our authority in some ways, and takes some important next steps for mental health reform. And I invite you and thank you all again for your participation with this work. I think at this time it might be good if we would go to Elizabeth Holcomb, and I would appreciate it, Elizabeth, if you would first introduce yourself and tell us about the paper and the materials that you have helpfully provided for us this afternoon. Thank you for being with us.
My pleasure. Thank you for having me. My name is Elizabeth Holcomb, and I serve as the legal counsel for the Governor's Office of Health Strategy and Coordination. I'm really excited to join you today and present to this subcommittee on workforce and system development. I prepared over the time that I was, since joining OHSC, which is the acronym for our office, data sharing is something that we have been looking at. It was kind of one of my first projects that I was assigned to look at. And so after attending the full BHRIC meeting and hearing about the interest in data sharing, we had shared some research and an executive summary of that research. So I believe both documents have been shared with the subcommittee members. I guess we can go ahead and start with the presentation here. So I just wanted to start with a brief history of the office and its priorities before diving into the discussion points that I've prepared today, specific to the topic of data sharing. The Office of Health Strategy and Coordination, or OHSC, as we call it, is a division of the Governor's Office of Planning and Budget that was established through House Bill 186 during the 2019 legislative session. And it was established with the purpose of strengthening and supporting the healthcare infrastructure of the state through interconnecting health functions and sharing resources across multiple state agencies and overcoming barriers to the coordination of healthcare. Governor Kemp appointed Mr. Grant Thomas to the director position in June of 2021, following the office being funded by the legislature earlier last year. Since then, OHSC has prioritized working with agencies and outside stakeholders to understand the healthcare landscape in Georgia and to coordinate strategic actions. I've included our mission statement here and some powers and duties that are enumerated in statute, which include the facilitating collaboration and coordination between state agencies, coordinating state health functions and programs, serving as a forum for identifying Georgia-specific health issues of greatest concern, and promoting cooperation from both public and private agencies to test new and innovative ideas. In addition, our office also advises the Governor's Office on all healthcare policy issues. We can move to the next slide, please. So over the last year, our office has examined various issues related to the practice of data sharing in state government and approaches taken by other states to optimize interagency data sharing, with a focus, of course, on Georgia. While some agencies may not have a need always to share or receive data from another agency, there is an undeniable benefit and need for state agencies with shared clients or spanning multiple programs funded by the state or in different delivery systems to be able to share data. This is especially the case for the state's health agencies, which of course we are dedicated to coordinating between, and they are organized in silos to allow for the specialization in different areas of healthcare. But in terms of data sharing laws and privacy laws, they are considered separate entities when it comes to sharing data. From my research, several states have recognized the important role data can play in enhancing the delivery of services and improving overall efficiencies by establishing frameworks for statewide or interagency data sharing. And so I want to just take a moment to kind of define these terms of what I mean by interagency data sharing. When I say that, it refers to any exchange of data between or among two or more state agencies. And the practice of statewide data sharing refers more to the state's overarching system and policies for data sharing between agencies. So think more uniform statewide approach or infrastructure. From my research, I've found that states' approaches to data sharing vary in governance structure and operation. Some utilize a central data repository that holds all of the data in one place, or an integrated data system as a conduit for the receipt, maintenance, and transmittal of the data from one agency to another. Others have designated a specific entity in state government or a state data officer that oversees the coordination of data sharing between the agencies. And almost from my survey of various states, there's different approaches to establishing the structure or the framework that supports the data sharing between agencies. And it's usually one or a combination of either an executive order, legislation, task force committees and commissions such as yourself. And also they are usually supported by formal data sharing agreements, such as memoranda of understanding, MOUs, and data use agreements, also called DUAs. And like I said, most states designated some entity or agency that is responsible for overseeing the exchange of the data, but they may not be necessarily charged with housing or creating some kind of integrated system. Next slide, please. And you can't invite an attorney to speak without getting a little bit on the legal framework and the laws. Of course, data sharing is easier said than done. The practice of data sharing, whether it's private sector or public sector, is governed by several laws on the federal and state level that depend on the entities seeking to exchange the data, the type of the data that is being exchanged, and the reason that they're exchanging the data. This legal framework of information sharing is an important piece of responsible data sharing. There's no state that has overcome barriers to data sharing without putting in place proper protections for data and respecting the data laws on the state and federal level. From my research, I have found that the states have made the greatest strides in creating systems to support interagency data are still faced with some limitations surrounding the exchange of personally identifiable information. In the healthcare world, we call that PHI, which refers to personal health information, which is protected by Hipaa. But realizing that these limitations exist and getting the right players in the room to have these discussions usually the states that have tackled this they can strike an important balance of looking at privacy laws, optimizing the intent of exchanging data when they can, and weeding out any perceived barriers that or discomfort that other agencies may have when it comes to the exchange of the data or keeping it secure once it's exchanged. And that has, in many states, affected a cultural shift in the attitudes just around data sharing generally. For example, I mentioned Hipaa. I just included this one example here. There's the Hipaa privacy rule that it permits a covered entity to use, which is most of our state health agencies, to use and disclose protected health information, or PHI, for certain healthcare activities, which include healthcare treatment, payment, and healthcare operation activities. And within those three topics, care coordination is included. So that's one example of kind of a workaround or a permitted use of and disclosure of protected information. Next slide, please. So to give a baseline of what Georgia's data sharing environment looks like right now, I just wanted to kind of lay out an overview from what my research has shown. We do have state agencies are subject to security and privacy standards that are set by GTA, or Georgia Technology Authority. We also have a Georgia Data Analytics Center, which I'll let Conti get to that one in her presentation, but that was created in HB 197 in 2019. And the statute calls for an integrated data system to be established with the authority to seek out data from state agencies to further research and inform policy decisions to support the health, safety, and security of Georgia citizens. As far as what Georgia does not have is we're missing an overall statewide approach and standardization to data sharing. Currently, agencies do not have to share when they go to request data from another agency. There's no default system through which they have to request that data or disclose the data if you're the one receiving the request. So you don't have to use any kind of integrated data system or a central data repository that you're requesting it from. There's also, I guess there's not a warehouse of data that everybody automatically gets sent to get the data, and is not updating it on a daily basis or a routine basis to create like a repository. There's also no uniform statewide protocol for agencies to submit requests to another agency, which includes some states take the approach of kind of having a referee or a request process, a review of each request, and an override agency. That is something that we don't, it's usually just kind of taken up agency to agency. We would like to have this data. This is why. And then usually the legal departments talk to one another. And many of our agencies have shared data successfully with one another. And some they're still, one would like data from another and they're not able to get that data for various reasons. But those that have successfully shared data are most, when it comes to anything that's personally identifiable, especially, they will execute a data sharing agreement. But in Georgia, there's not any type of default process for drafting that kind of data sharing agreement. It's usually starting from scratch, using maybe a form document that their legal department has. I've had the pleasure of assisting the Georgia Data Analytics Center and executing several of these agreements. And once we get in a rhythm, we like to go back to a certain one. But the idea that you could have, all the experts in the room around data sharing develop a standard template is an idea that that would be exciting to see in Georgia and has been successful in other states. Next slide, please. And so I've given you kind of the Cliffs Notes version here of some of the information that you can read in greater detail in my documents that went out earlier. But I compiled this slide to go through various policy considerations for Georgia based off of the research that I've seen in other states. I touched a little bit on some of these in the previous slide while kind of enumerating what Georgia does not have in place. So the first bullet here is to create a uniform statewide process or system by which interagency data sharing can occur. Like I said, there's no statewide protocol to submit a request from one agency to another. Coordinating the development and use of a standardized DUA or MOU by all agencies would be a great step in the right direction. Some states have what they call enterprise MOUs that are the result of the executive branch, legislature, and any related parties wanting that are interested in data sharing kind of coming together and tackling that's template that I was referring to. And that is a great, usually the template is developed based off of discussions where everybody who maybe has an opinion on what data can be safely shared under and not in violation of federal or state law, people's understandings and comfort around sharing data, it helps to have discussions with people who see it from different ways, and then they can come to a resolution and develop a template that recognizes where the limits exist and where they can actually share data. Another idea that is to consider coordinating interagency data sharing through a designated entity that oversees data sharing for the state and facilitates the actual transfer of the data. So I referred to kind of the term referee, an agency serving as a referee for data sharing. And so that's what I'm talking about here. Then also, you want an agency who is able to put in place the privacy and security concerns and standards that are set by the state. In Georgia, that would be done by GTA, but also for the proper storage. And then also determining whether the designated entity should also serve as a central data repository to hold all of the data. Some states have not wanted to take that on. And because that is obviously there's different platforms, and I'll let Conti be the expert on that. But some states have decided that they just want somebody to facilitate. So they're acting as liaison from one agency to another to coordinate. Each agency holds its data and they can disclose it to another agencies. There's not one central repository. And another, finally, this is a good segue into GDAC, is empowering the role of GDAC to kind of play that role, that referee or coordinating entity. And there was a bill introduced by Chairman Tillery this past session, SB 374, that if it had passed, it would have created a assignment of GDAC to each agency. So GDAC would have been considered an agency of all executive branch agencies for the purpose of sharing what they defined as government information. And it would also be considered an authorized receiver of the government information. And so this is especially important to HIPAA covered entities, because one HIPAA covered entity can share to another, but you cannot share to other entities that are not covered under HIPAA. And so for that to not be a permitted disclosure, adding GDAC as being the same as being an entity within an entity would have helped override that barrier. One thing that I would like to point out that was that I think is important to note about GDAC is it is created integrated data system with specific things enumerated in statute, but it does not actually spell out if it plays a role in coordinating the exchange, but it's there and it's created and it's they're doing a lot of exciting things. And so I think it's worth revisiting SB 374 this upcoming session and looking at kind of reviving that language, but also looking at some other things, which could include GDAC kind of wearing that hat that I keep on referring to as the coordinating entity. I know I went kind of fast, but it's a lot of information. I was kind of just wanting to lay out the high points and encourage any feedback or discussion or questions either now or after the meeting. But I really appreciate the opportunity to present all of my research to you and your subcommittee, Representative Oliver.
Thank you, Elizabeth, very much. For the benefit of those listening and maybe looking at Senate Bill 374, you may note that it's got two big sections to it. The first section is a bill that wasn't related to the original purpose of 374. In the last days of the General Assembly, we do combine bills, and a bill about fees charged by agencies was put on the 374 bill. The 374 original document is kind of the latter part of the 374 that's before you. And one of the reasons that we're having this discussion, and I'll have some questions myself, I'm sure others will. I think I'll ask just one or two now, and then after Conte speaks, we may come back to some other questions. Elizabeth, do you have a copy of all the MOUs that have been signed by Georgia agencies in your file somewhere?
I do not have. I have some that I've worked on behalf of GDAC with Conti. So we have those that we keep on file, of course, but I don't have access to ones that have been between other entities that
I think as we move towards preparing a draft of issues for 374 or amendments to 374, or want to discuss changes to 374, it might be good to have a list of all the MOUs, because having a standard form as a beginning point anyway is something that I'm sure we'll be discussing. I'll just ask one more question, then Conte can answer this question now, or we can hold it to the end. My reading emphasizes for me the need to de-identify data, but I don't think de-identification is in the 374. Elizabeth, do you want to give me an analysis of whether we need that in 374, just as one example of questions we need to be asking, and then we'll move on to content.
It is not addressed in the version of 374 that we have seen.
What is it? Why don't you start by telling us what it is? I think I know what it is, but I bet you've got a better idea than I do.
Well, I will defer to Conti as to get really technical on the de-identification, but basically any identifiers that you could link to anybody's personal information so de-identifying it. The data would be stripping it of all elements that are personally identifying. And I think that from a legal standpoint, you could push a lot of data sharing if it was all de-identified, right. But the whole purpose behind sharing that data and the utility of the data elements, once you've shared it, you may not have the ability to put it together in any usable way that helps tell the story that you're seeking to tell or wanting to uncover. So I'll I'll let Conti get into kind of ways around it where you're balancing, not revealing people's private information, not being able to know we're talking about this person in this rural county, that there's only 3 people who see that doctor. So you can there's certainly concerns where you don't want people to know about people's private information, but you can kind of tag the data and so that you know certain things, certain elements that are usable. So you know that person's maybe age, some of their demographic information, but I'll let Conti talk a little bit more about that.
Conti, introduce yourself, please, and then start with your presentation. Then we'll come back to some of these weedier questions. And again, it's for the purpose of highlighting some issues that we'll be moving forward with in the future. Thank you very much for your time.
Thank you so much, Representative Oliver, for having us here. And we really respect all the work that the commission does and happy to support and assist in any way we can. I think I'm going to start out with answering. I'm Kanti Chalasani. I'm Director for Georgia Data Analytics Center. I have been with State of Georgia since '97. I have worked on several data warehouses and data systems in the state where we have built longitudinal data systems which de-identify the data. What that means is we take data from multiple locations, multiple agencies. We use the personally identifiable information to link the puzzle. But in the longitudinal data system, we do not bring any of the personally identifiable data elements. For example, date of birth. We might calculate the age and just put the age, and the actual date of birth is not going into the system. We don't take names into the system, and we will be able to conduct the research with the de-identified numbers. So we may be creating our own unique ID that will allow us to do the counts, to do the metrics. For example, in case of discipline data, we will be able to say which population, how many counts, what actions were taken, was there any bias in the incident versus actions. You can do that kind of research, but you will not be able to identify who that population is to protect the privacy of the underlying data system. So that's what the identification process is.
And you do that de-identification now in the data you have, yes or no?
Yes, by law, House Bill 197 requires us to report only on aggregated data.
Okay.
So we use it for linking and de-identify and aggregate it.
Do you do that with a vendor, or is Georgia Tech part of that, or how does that actually happen?
So in the state, usually they use a tool called Master Data Management System, where a unique ID sort of SSN is generated, and then that person ID is used everywhere else. GDAC's budget is limited. What we are doing is the source systems are giving us the person ID. So we are using their de-identifying systems to leverage that into GDAC.
I won't interrupt you again until you're done. Please proceed with your proceed. Thank you.
Thank you so much. My presentation is with someone. Do you want me to present or? All right, thank you. All right. I just wanted to start out with saying Georgia Data Analytics Center was established with House Bill 197 with the intent of building a centralized data repository for state of Georgia so that we can establish transparency and data accountability. We were tasked with establishing a data system which will allow for governed data access for the timely and accurate data availability for legislators, for policymakers, for researchers, for state agencies. Data has been collected in several agencies for last 2 decades. Each agency looks at their data from their own purpose, but GDAC's role is to bring it to a central repository and connect the dots for a larger research. That's what Georgia Data Analytics Center is. to do this work, if we can go to next slide, please, we formed a data governance oversight committee. So this committee helps us define policies and procedures. They look at data security and privacy laws for each of the data set that comes into the data system. And any use case we pick, this committee prioritizes it and approves it, only after which we can begin our work. Once this committee says, okay, this use case is approved, we reach out to the agencies, we request the data, we work with Elizabeth Holcomb, who is our general counsel for Georgia Data Analytics Center. We establish memorandum of understanding or data sharing agreements, as she referred to them. Once the data sharing agreement is done, sometimes it depends on, because there is no standard process, some agencies require us to spell every element in their data inventory in the data sharing agreements, whereas others allow us to put a blanket, let's say, foster data, or at a high level SNAP data, TANF data. They are able to define at a high level for us to identify individuals. So there's no standard process. We work with attorneys and contract divisions of different agencies and take the pathway, basically water finds its level. That's how we are operating right now. It's difficult, but continuous follow-up and persistence is what matters. We continually chase these data sharing agreements and these use cases. Week after week, month after month, we continue to send the emails till we receive these data and we are able to fulfill the use case. If we can go to the next slide, please. So to do all the work that GDAC needs to do, we have, obviously, like any other project, our three key pillars: people, processes, and platform. In terms of people, GDAC has been extremely blessed to have executive leadership support. Our governor and our director of Office of Planning and Budget strongly believe in putting technology at the forefront to build a modern data architecture. So we had, with that clear goal in front of us, we built a data system which is extremely efficient, and we have scalable, repeatable processes. So these automated processes, all we have to do is drop the file and they pick up and process, curate the data. We just have to work with the subject matter experts to establish data literacy. So we established an automated data submission process, a proven methodology of gaining knowledge of these new data sets, and then building the use cases in partnership with the agency. So we have all of our data governance committee members to thank. They are representative executives and chief information officers, business stakeholders from every agency with which we establish a data sharing agreement. So it's a partnership. We all work together as a team, and GDAC team itself is a small team, but because of the platform that we have developed, we are able to do more with less here. So that's about our people, process, and platform. Let's go to the next slide. I think what I wanted to do is, knowing what Elizabeth was presenting today, I wanted to present the scenarios of how GDAC used her help in getting the data from different agencies. So what I did is put together 4 different scenarios here, and usually each agency falls into one of these 4. If we can go to next slide. Scenario 1, I think we skipped 1. Thank you. So this is our best case scenario where someone submits a use case and we just go to the business user who says, or the data custodians as we call them, and they look at the use case, they give us their data inventory, we review and identify the data elements that we need, We establish a data sharing agreement if it's not public data. If it's public data, then we just request the data. We establish a secure data transfer, and data are ingested. We analyze, we build our analytics, we give it back to the agency. Agency reviews them, okays it, and we publish. So this is our smooth, happy day scenario. If we can go to scenario 2, and in this scenario, the executive leadership of an agency would be highly motivated to have GDAC at the table, to take GDAC's help in building the use cases that they want. They would help us with putting a data sharing agreement together. And then we would have to, depending on the use case, we would have to work with different business teams. So one business team may be owning a complex system, but they are patient, they work with us, takes months to identify how to pull these data out of the systems, how to transfer, what to ingest, and how to do analysis. Whereas the second business team got the directive from their leadership, but they're not on board. So they use techniques of stalling or pushing the meetings out, or just not saying anything and just repeating the same discussions meeting after meeting and not progressing, thus blocking us from making any progress. So this is just a good scenario. High-level leadership is on board, but then a particular team is trying to put roadblocks even after the data sharing agreement is in place. If we can go to scenario 3, please. So in this case, the executive leadership is not on board. Our leadership and many other leaders of different agencies who are interested in that data, they meet, they take 6 months to talk to each other, and finally they all come on board. We are given multiple use cases. For use case 1, we succeed in doing a data sharing agreement. We get the data, and that data team is extremely good. We just in 1.5 months, we are done with our analysis. We publish our dashboards on the websites. And we also take the data for additional research. Whereas in the same group, there is a second team which takes longer to do the data sharing agreement. No proper explanation for the delay, but they just, because there's too much risk involved, it's best not to give the data. It's easier for them to say no than giving the data. And it's that way they are able to do their jobs of protecting the data by just saying no. But we somehow succeed in persuading them, and 8-9 months, we get the data sharing agreement in place. But now the data are not owned by them. It's owned by some other third-party product. And again, we have to start over with another process with that third party in filling all the paperwork and forms all over again, to the level that they would need my social security and my date of birth to give a data to state entity, which I had tough time wrapping my head around, but it is what we had to do to get these data. So, and now scenario 4. So in this case, executive leaders are very excited, and at surface level, they say we are on board. And their privacy officers and attorneys are at the table. They keep pointing to federal guidelines, saying, I cannot give you these data. If we give you these data, our federal funding will be chopped. And they would say, we are going to seek federal guidance. They will go to the federal officers month after month. They would be talking to these federal groups, even though we point them to previous longitudinal, because I've been in the state for 25 years now. I know this agency had participated in other longitudinal data systems. I point them to those data sharing agreements that are already in place, and tell them that I personally have used these data in the past, but yet months pass, multiple escalations. Every time executives meet, I get the news that they're all committed, data is coming, but months later, we still don't have the data. So these are the different scenarios. I don't know how we are going to solve these problems because some of these are people, some of these are processes. So I just wanted to, knowing what Elizabeth was presenting, I thought this was best for this group to hear. My apologies if I digressed from the topic.
I think that's very helpful. It's very helpful to me. Thank you very much. The obstacles are either people or process. And before we open up to questions, I'm kind of curious, what are the examples of, what are the options to put new language into 374 that may solve some of the process problems and not all the people problems? One question, Conte, do you have a copy of all the MOUs that you think have been executed?
Yes, I do. I will email them right after this meeting.
It really seems like an obvious option for us to spend time on, be valuable for our time to talk about a standardized MOU, at least as a beginning part. And so I'm hoping some very smart people will spend some time on that. I've got some other things on my mind, but let me open it up right now to see who else would like to ask both of these very informed professionals good questions or bad questions, whatever you want to ask. Cindy, you want to go?
Yes, I have a question for Elizabeth. Based on your research, Elizabeth, I did review the document that you provided us, and I see that you looked at different things from a variety of states, Illinois and Ohio, Washington State, Virginia, and so on. I was just wondering if you recommend that we take a deeper dive into any one particular state and how they're utilizing the sharing of data.
Good question.
Yeah, that's a great question. I really like the approaches in Illinois and Indiana when it comes to their approach to standardized data use agreements. What in a lot of these states, they call them different things. In Illinois, they refer to what they did as an enterprise MOU. And so it's among 13 state agencies. And that's the result of them coming together and figuring out like, okay, where do we agree? Where do we disagree? Let's talk about where we disagree. And then they put their heads down and came out with what they call an enterprise MOU. So that is the default that they use across those agencies that kind of put their heads together. Indiana does not have an enterprise MOU, but the approach in the systems thinking is similar. They don't start from scratch with any data sharing agreement. They have templates on files that you aren't starting just with a blank page each time you go to an agency, or starting with what, one agency may have kind of their form document they've used for 10 years. Another agency may have one that nobody likes, or, so you're kind of starting with the negotiation just without any baseline. Indiana has some standard templates on file that people like. There's some respect for that. So I like those two states for the standardization of the data of the agreement piece. As far as another state that I really like the approach is Ohio, and they did it by executive order, but that wouldn't have to, it's not really about how they did it, it's what they did. The order established a presumption of data sharing. And so unless there is something that says you can't, the presumption is that you can. Mm-hmm. And so if there is anything in state law to the contrary, that executive order trumps that. It says that you're going to share the data agency to agency if there's anything in state law that conflicts. And of course, that's within the privacy protections. Like, you're not going to share sensitive information about, mental health and there's different things that, so I'm not insinuating that it's just like an open file, they're rifling through each other's things. But just that attitude that we are going to share it, I think is huge. The federal law piece, you're never going to find a silver bullet solution to just freely share, things that are substance use disorder or HIPAA covered. But states have been innovative in how to do it. And like Conti touched on the de-identification piece, when you do de-identify and how you do it, and everybody's comfort level around that is key. So I really like Ohio for the that presumption, that kind of attitude.
Anybody else?
I will step in, and this is really talks to my world too, because I worked with billions of medical records, identifiable medical records. So I acquire my data sets from CMS, and I have the Medicaid claims records for the entire US for many years. And I've attempted to acquire that same data from the Georgia Department of Community Health, and there were some challenges. And I understand, the challenges behind that. There are a lot of legal aspects that come with that. And I really welcome the effort with this bill and the standardization idea. What I wanted to bring up, to the discussion is that CMS is pulling its data from 50 plus states. And of course, it's a standardized data. It's easier because the data inputs are similar across states. But at the same time, they are working with all the states to pull this data under CMS, and this is identifiable data. So I think if looking at their how they structure their DUIs and how they structure their agreements and the approval, they actually have a consulting company that works with them, and whoever actually, so although that's a public data, getting that data, actually there's a 50,000 fee per year to pay to get the entire US. So, but that goes mainly toward that support, consulting support. So I understand that there are a lot of challenges with standardizing, with getting through DUIs. You'll have to have a larger legal office to deal with all those situations, all kind of situations. But so I wonder whether a fee would help with that, to pay for the consulting. And also looking at CMS, how they structure their approval system. And so it could be a good example to look at it. Since again, they're working with billions of records. It's much larger than what we're talking here. And those are identifiable records. And to talk about the de-identification, there are also 3 different ways. They're identifiable data, the limited data sets, LDS, that's actually in between, and then the de-identified data. Usually the LDS provides more information such as zip code, and often many policymakers are interested on knowing where their constituents are. So I think that it's kind of somewhere in the middle in terms of de-identification. So keeping that in mind, not make it identifiable or de-identifiable, keeping that middle ground also in mind, that's very important.
It's very helpful, very helpful. Some of the options I've looked at seem to appoint somebody to be, I'll use this term, a czar, to make the decisions. So that an agency A can ask B, and then B just sits in the road for 90 days and does nothing. Conti, I don't think you have that authority today as to be the czar that says, I've reviewed everything, it's all legal, give it to them in 10 days. You don't have that authority, do you?
No, we don't.
So you are supervising an ongoing, undefined negotiation that goes off track frequently.
Yes.
And so what I'm thinking about, and I'll ask all of you for, Nicoletta, you may have the best idea, the most experience in this, is should you appoint somebody who's in charge that manages this conflict with deadlines and authority. Does that work? Does that help?
That's how CMS does, actually. They have a center that all the requests go to that center, and they have consultants that work with them and they review, so it's not going to be a biased assessment. So that's how it has worked. And again, you know, that additional support, the paying for the data helps with paying also that additional consultancy and additional, you know, because that's a lot of effort. It's not easy to review DUIs and all this data requests.
Does Georgia Tech have a role with some of these activities and issues?
So we do actually, so the project I'm actually principal investigator, we started as back in 2013, was a test project, I would say, for Georgia Tech. And we were, the legal office of Georgia Tech was also quite nervous to bring that much data at Georgia Tech with so much strings attached to it in terms of legal and privacy issues. But we've managed that project very well. We also have GTRI, and Elizabeth probably knows, works with them because they are running now the all payer database, all the support system behind that. So Georgia Tech is behind that and does have the expertise to support some of that, of course, and GTRI will be a very good place to go.
Well, the people on our subcommittee really have a lot, in different ways, expertise, and along with our presenters, to help look at 374 in detail and figure out what can we do to strengthen it. And that's kind of what's on my mind. Before we go to any further questions, I forgot to introduce Renee Johnson. Renee, are you able to unmute yourself and tell us why you're with us today and how helpful you are being to us? Thank you.
Sure. Thank you, Representative Oliver. Good afternoon, everybody. My name is Renee Johnson, and I am at the Center of Excellence for Children's Behavioral Health over at Georgia State University in our Health Policy Center. And my work is related to our system of care work with children's behavioral health. So working with our interagency directors team and all of the state agencies and other stakeholders who are vital to providing services and improving our behavioral health system. And I have the pleasure of working with Representative Oliver and supporting the work of the commission in this workforce and systems development committee to see how we can continue to bridge the gap and bring the necessary research and information to inform, have an informed impact on what we're doing. So it's a pleasure to be here this afternoon.
There are a number of different folks in the Andrew Young School that's helping with the Behavioral Health Commission this year, and they're very, very welcome. Ashley, you want to turn yourself on and wave to everybody and tell us what you're doing for the commission this year, if you're able to do that. Ashley Dixon has been hired by Kevin Tanner to be an organizational person for the commission. There you are.
Hi, everyone. My name is Ashley. I'm the coordinator for the commission, and I'm just here to help with whatever needs the chairs may have, or even Chairman Tanner. So it's a pleasure to see everyone today.
Thank you, Ashley. Y'all may know that the Todd Jones and I really didn't have any staff for the last year. Kevin, Todd, and I didn't have any staff for the last year. And so we've been significantly recruiting, and feel very, very much helped. I think Grant Thomas was a big player in getting us some help. And so we do have folks now that can help organize all the exhibits. Ashley will be collecting all the exhibits from our subcommittee, and all of this will be online and will be available through House Media for folks to review. Very happy with this new help. I think that the task going forward in relation to our discussion today is to really spend some time with 374, Elizabeth's paper, and figure out what is our best legislative steps forward. And there are a lot of questions that are out there, and we now have the benefit of all these other states and the success of their. What other questions do we have? I don't want to leave anybody wondering about the very complicated matters we've been discussing today.
If I may, I don't have a question, but I do want to say that with federal laws, privacy there are some toolkits available saying you can use these data for longitudinal data system, provided A, B, C. So there is a clear language, and it's a very clean workflow that was put in place by federal departments, which can be leveraged, and that sort of processes can be built for state that would help groups like GDAC.
Sally, you were about to ask something, weren't you?
Yes, ma'am. And I'm going to play this as just kind of stepping back because I'm not that familiar now. I'm real familiar with MOUs and that kind of thing, but I want to step back for a minute. And so we're talking about hospitals, we're talking about places that have received funding from the state, correct? I mean, they are like state agencies. It makes me wonder why there can't be some sort of executive, like you are accepting money from the state, therefore you are expected to share the data. I kind of get stuck on that because they are taking state money. And I understand, I'm very familiar with Hipaa, so I understand that part of it. But I also understand where the lawyers start coming in, and no offense, Elizabeth, or anything, yeah. but they do, yeah, they do muck things up, yeah. Some, and I really like that idea of one standard form. If you are a state agency and taking that money, here you got to do it this way, and you know, really having that defined, I think would be so much better than all these other little things that come in, and it muddies everything up so much.
We don't need a system where one MOU is 30 pages and one is 3 pages. And we've got to figure out who's an agency. I mean, I don't think the bill's clear enough about what's an agency. So let me give you an example. I don't know the answer to this at all, but content, Elizabeth. Department of Corrections, the personal identifying information, which may or may not be different from personal health information. Those two terms are used interchangeably. Are all prisoners have any privacy? I don't think they do. I mean, I'm looking at their birth dates. I'm looking at their, Department of Corrections is an agency for sharing data? Yes or no?
Yes, they did share data with us.
And is there any more openness to prisoner data than anybody else? I don't know.
We treat the personally identifiable information same for any agency, and we protect it. So we only use that data to connect with, for example, for population projections that OPB had done, you need to connect the dots. So we just used, we may not have used for that project, but we use it for counts. And we try to keep those data safe. Anything that comes into GDAC, because House Bill requires us to aggregate, we make sure we never put any PII anywhere.
Is PII and PHI different?
PII is personally identifiable information. PHI is personally identifiable health information. Yeah. The privacy laws are slightly different for PII versus PHI.
One of the reasons this question came up is when we were talking about 1013 procedures, it always got more complicated when we were trying to decide whether the law enforcement officer, who's immediately face-to-face with the person in a crisis, psychiatric crisis, what information would he or she be entitled to know? And that's just a stumbling block. We weren't clear with that. And that's an example of another state agency, the local law enforcement guy who is managing a 1013 crisis, or the co-responder person. That person should not have extensive information about. We talked about the frequent flyers, the number of people who had multiple psychiatric evaluations, ER rooms, in and out of jails. That's just an example of the data sharing that is a very in the weeds issue in our bill in how we defined it.
It's very critical, especially when a homeless person with behavioral health issues is found on the streets and somebody is trying to help them. it's very critical that they get access to these data.
And I have been in, I don't know how many conversations over a long career about the state ID for a homeless person who's not ever going to have a driver's license.
Mhm.
That's a recurring issue in our homeless illness, mental illness or homeless population that comes back and forth. Nicoletta, I think you're the person that's really dealt in this a lot. So I'm going to call on you to help us with this draft issue. All of us are on the subcommittee because y'all have this expertise on this data collection issue. I'm just always really intrigued by what Georgia Tech or Georgia State, just two examples, are already involved and already have their fingers deep in these policy issues that we're struggling with.
If I can just add one thing, another plug for another state, Illinois, I praise them for their enterprise MOU approach, but they also established a process that's sort of, they call it a FOIA-like process for requesting data from the departments. So they have empowered if a department wants to deny a request for a certain legal reason, then they have empowered their state chief information officer with the power to overturn that denial if they find that there is not a valid reason. So that would be a state to kind of look at that process. I think you could empower an agency to do that or just a state officer. But I just wanted to kind of clarify that. And then to Sally's comment about the hospitals or what is an agency. My research was limited to just full-fledged state departments and agencies, no public-private partnership. So it wouldn't be I was not extending it to hospitals that would receive some state money. I was limiting it to like the Department of Community Health, which would hold like facility information and Medicaid information on a personal level. But I limited my research to just state executive branch agencies. That's helpful.
Very helpful.
Yeah, and it really depends on which data set we're looking at. So with our committee, there are a couple of things. One is really regarding the workforce and the data set that we want to collect there so that we know specialties that our clinicians have across the state, how many are there, where are they located so that we can direct people to them. Mm-hmm. So I don't see as big of an issue with that type of the data.
No, I don't think so.
But whenever we're talking about mental health or substance use records, it's a different issue. However, as you know, we look at House Bill 1013 and also Senate Bill 403 with the co-responder, partnerships are really important too. And so when we're looking at a clinician that is responding with law enforcement, the clinician can have access to those mental health records and can advise then law enforcement with regard to that. So we are seeing some really good partnerships being formed to overcome those barriers of not being able to outright share the data. But that's definitely a way in which we can attack or address that.
Very helpful.
There is a committee, and I'm actually one of the subcommittees on the use of all-payer database. There's been a whole year, actually, conversations on the data use. Are there any conversations with them? Because they're looking at also various aspects of centralization of the data use agreements. They're looking at those aspects as well. And there's been a lot of conversations. We had monthly meetings as well.
Tell me again who they is. I missed the first of that.
The all-payer data set. They're the all-payer data use. I forgot the
the APCD, the all-payer claims database.
Oh yeah,
yeah.
Okay. And that's up and running now, isn't it, Alyssa? You worked on that when it came out of the Senate with Senator Kilpatrick, didn't you?
Senator Burke, and Senator Kirkpatrick, yes, we are, the Office of Health Strategy and Coordination is still working on the implementation of the APCD.
Okay.
We have an advisory committee, and then I think Nicoletta, you're referring to some of the working groups that I'm currently assisting the data use agreement work group. And so the APCD, we are there will be a software vendor that de-identifies all the data. And so any data that we are talking about with the APCD is already considered a limited data set. And so that's just specific. We're focusing our efforts on just for the all payer claims database and that project and the requirements for the that were set forth in statute and then under federal law. And so we are looking at a lot of the same things, but it's very specific to that project and requirements. So I guess some of the ideas do transfer, but not actively looking for solutions for agency to agency, because we have in the statute for the APCD, there's submitting entities as a defined term. And so there's named entities that are required to submit. And so because we have that state law, that's compulsory to submit to the APCD effort. But then, like I said, there will be a LDS or a limited data set that we're looking at. So it's a little bit different, but related.
I've been hearing that it's right. Would you send me the citation exactly for the data collection of the all payer system?
Yes,
Excuse me, Conte, go ahead.
And there's a learning there to do, right? Because there are entities versus agencies, right? Yes, this data looks standardized. It's easier to centralize it. But I think there's a learning there from that bill to this new bill, because you could centralize it in a very similar way, use very similar software, use very similar vendors. I don't know. There's a lot of learning from that.
I think that's a good question, Nicoletta. Grant Thomas and Office of Health Coordination is overseeing that all payer claim database. And in fact, when they wrote this RFP, they did add a tail end component where it doesn't matter which vendor is building the longitudinal data system, they are going to push that data quarterly to GDAC so that the state owns that data at the back end. So yes, we are in connection, and Elizabeth is part of those meetings daily, and I do attend as well when needed. I think that was the main thing. The second thing that I wanted to touch on, I think Cindy mentioned about workforce data. We did work with Chet Pessin and Liana Greenwood from DCH Health Workforce Board. And in fact, if you go to gdac.georgia.gov, we took the data set from the survey that they gathered from Secretary of State's office. And you can see that we have published 3 new dashboards where you know your nursing workforce, your physician assistants, and your physicians. It's there, it went live last week.
Good.
On the website.
Yes, that's great. Good.
Thank you. Who else would like to offer up any new task for us? My major task based on this discussion is to start listing from you and requesting for you, and Todd and I always had this kind of discipline. Give me the page and line number where you want to add, subtract, redefine, clarify any language on 374. I think whether or not the ultimate powers that be decide that that'll be in what format that'll be part of our legislative package for 2023. We're not making decisions right now, but we're offering up ideas and suggestions. And from my perspective, the sooner we get it in writing, the more we can share and get further input from people who really know a lot about this area. Elizabeth, is that all right with you if we proceed down that path? Just to get some ideas on paper.
Yes, absolutely.
So I invite all of y'all to look at that bill 374, not the part about the agency charging fees for tires or anything like that, but the part of the bill that talks about data sharing. What else can we solve today? Anything else? Y'all have been incredibly generous with your time. I really appreciate the work you did, Elizabeth and Conti, and Nicoletta and Sally and Cindy and Renee and Ashley. All of you contributed to this. I know there are people out there listening, and I know this really helps us get further down the road. I do want to have our next meeting in person or hybrid. What that means is hybrid, and late October, and I'm sure we'll have a further discussion about these important issues, but probably others too, and give you update. I know that Kevin Tanner will also be scheduling full commission meetings. Don't know what his schedule is on that, but we are going to do a lot of sharing with to represent all the work we're doing. And I'm very, very grateful for all of your time and effort today. Good afternoon. With that, we will conclude. Thank you, ladies.
Thank you.
Thank you, everybody.